Hi, this is Dr. Thomas Lodi. Today I want to talk about prostate cancer. Um, One of the leading causes of cancer in men. Uh, it's an unusual cancer in that um, if you do autopsies on people over 90, men over 90, who died of many other causes, 95 to 100% of them have prostate cancer. So prostate cancer is not one of those cancers that always is going to lead to uh, stage 4 dissemination, stage 4 metastasis, and death. Okay? Many people live many years with prostate cancer. Uh, Now, prostate cancer basically is breast cancer in men. It's got hormone relationships. But the hormonal relationships have been very confused. And so I refer you all to a series of articles by a Dr. Morgenthaler from a Harvard urologist who said, let me figure out where this whole idea about testosterone and prostate cancer came from. So we went back and did all the research, looked it up, very thorough job, and found that there was one small study that showed a relationship, and it turned out to be a flawed study between prostate cancer and testosterone. Um, and but yet it's used all the time. We look at that, we follow that, we follow PSAs, we think, and so a lot of the therapies are based on that assumption that testosterone causes prostate cancer, or at least feeds it. All right, and they have some reason to believe that, because if they do bilateral orchiectomies, which is what they used to do, which is where they remove the testicles, and there's no testosterone being produced, or very little in the adrenals, it goes down for a while. Then they, as science progressed, they wound up coming up with androgen blocking drugs, where they actually block you take a drug that, or a shot that blocks the ability of the testes to make testosterone, and we see that it slows everything down for a while. But then it comes back up, and that's when they call it hormone-resistant prostate cancer. And so hormone-resistant prostate cancer is harder to treat, is what they say. Well, it's because they were just using that that therapy, that concept that testosterone was related. But you have to understand, just thinking about prostate cancer, if testosterone were the cause, then we would expect every young man at the age of 18, 19, 20 who has an erection all day to have prostate cancer. But we don't. We see it in the older guy who can't get an erection anymore. So how does that work out? How is it that testosterone is doing that? Why is it? So it turns out not to be the case. It turns out the studies are showing that basically testosterone, as we know, like all hormones, gets metabolized and turned into other hormone metabolites. And it's those metabolites, and especially estrogens, that lead to it. So that's why I say breast cancer and testosterone, breast cancer and prostate cancer are very similar in that regard. However, remember, in both of those situations, hormones can only kind of, they're one aspect of the whole picture, okay? Because you can have an overwhelming amount of estrogen in a breast cancer positive patient, and if you completely change the milieu of their environment, of their body, so that the cancer cell is no longer a cancer cell, it won't have any effect, and the same with prostate cancer. But the basic therapy, the standard way you go with prostate cancer is that you wind up in the last few years of your life, because you wind up dying from the treatments, because you wind up impotent, in pain, sick, you lose your quality of life. And for men, a very important thing is having sexual function, and that's lost almost immediately. So we find that men like that are getting depressed. We find that men like that are don't really care about living anymore once that sort of happens. So anyway, there's a way to get around that. There's a way to not do that, and that is to treat cancer the way we do with all cancers, and that is reverse it, bring it back to being healthy cells, and not poison the body. So we don't have to have surgery, we don't have to have chemotherapy necessarily, and if we do, it's going to be low dose with insulin, so that we don't cause side effects, we minimize those side effects, and radiation, of course. One of the big one of the most important ways they treat prostate cancer now is they put these radioactive little rods into the prostate, so and it just keeps producing radiation. Anyway, it turns out not to be the best idea, and it turns out that there are a lot of other alternatives to deal with prostate cancer. So prostate cancer, we can convert almost all prostate cancers, which would be aggressive and could end in a quick death, into what most men have. Most men who live to 90, 100, 110, yeah, they had little islands of it, but it never meant anything. So that's what we want to do with prostate cancer. We want to do that with all cancers. We want to turn the cancer away from being a cancer back to being a healthy, functioning cell.